Hello, everyone. Welcome to another review for our students. We continue with patterns in the TCM patterns for diabetes. And let's welcome straight from Sampaloc, Manila, Ma'am Trix Guevara. Good afternoon.
Good afternoon, Doc.
Yes. Okay, today we shall be asking you to identify or define or describe the terms, no? Okay. In diabetes kasi, like we always encounter these terms. We call them the trio, no? So
Yeah.
when you have these things, they signify heat, like too much heat. So what does polydipsia mean?
It means of excessive thirst or chronic excessive intake of water.
Yeah, because you're thirsty.
Yeah.
Of course, no, automatic ka iinom mo. What about polyphagia?
Um, Excessive appetite or excessive eating.
Okay. Um, yeah, so the third one is polyuria.
Excessive urination, increased frequency of urine.
So we have
Urine.
polydipsia, polyphagia, and then we have polyuria.
Polyuria.
Okay. What is your treatment principle to treat upper wasting? So when you say upper wasting, we're referring to too much heat in the upper burner.
To moisten the lungs and clear the stomach.
Okay. So, okay, bakit napunta si stomach sa ano? Um, yeah, we all know about the relationship between the lung and the stomach, no? Mm. So the lung is the one in the upper burner. So if there's too much heat, eventually, if you remember the tongue, no? Eventually it affects the lung. Diba? So if you have too much heat in the stomach, it goes up to the lung. So the lung is also dry. So your treatment principle to treat upper wasting would be you just don't moisten the lung, but you also have to clear the stomach heat, because it's the one that causing the heat in the lung. That's why you feel thirsty. And how do you treat middle wasting?
And the wasting is to clear the stomach and then enrich the kidneys.
Okay. If you have kidney yin deficiency, makes sense. The kidney, di ba, sa lower burner siya, no? Lower chow, remember? However, it is connected to the spleen, right? And the spleen is partnered with the stomach, no? So
Mhm.
if you have kidney yin deficiency, it will definitely affect the stomach, no? Kaya when you treat the middle warmer, when you treat middle waist, by the way, I failed to mention what's the Chinese name for diabetes? It's called xiaoke, no? I don't know if I pronounced that right. So it's a wasting disease.
Yeah.
Yeah, xiaoke.
Uh-huh.
So sa totoo lang, when you have the
Siya.
middle burner dito is the stomach. So um, you just don't clear the stomach heat, but you also have to tonify the kidney yin. You enrich the kidney or you nourish the kidney. No? So dito mo makikita that the kidney has something to do with the stomach. Diba? If you remember our discussion on the tongue, when um when you have kidney involvement already, where you see the tongue has no more coat and it's red, no? It almost always involves the stomach na, right? So
Yes.
when you treat middle wasting, if it's you're having issues with your stomach, ang lakas mo kumain, the appetite is voracious, no? So there's so much heat. So you just don't clear the heat in the stomach, but you also have to do something about the kidney yin. Okay? The same thing is true when you treat upper wasting. Okay? So you just don't moisten the lung. You also have to clear the stomach. Okay? Diba? Di ba malapit lang ang stomach sa lung area, sa tongue, right? Mm.
Yes.
Yeah. And so is the kidney sa stomach. Now, to treat lower wasting, so how do we do it?
Enrich the kidneys and then supplement the lungs.
Okay, why do we have to supplement the lung? What does the lung have to do with the kidney? Because the kidney, remember the five elements. At saka, di ba, like, how do I say this? If the Okay, when you have lower wasting, it's basically the kidney that is affected. But again, the kidney is the son of the lung. So the lung is supposed to be the mother of the kidney. Make sense? No? So the lung is so sensitive to dryness. So you have to nourish or supplement the lung. Um, aside from nourishing the kidney. So the term here should be nourishing or tonifying or enriching. Make sense?
Yes.
Now, this is the pattern known as lung stomach heat accumulation and fluid damage. This is also known as,
Upper wasting.
okay, di ba kanina, how do we treat upper wasting? You just don't
Moist.
moisten the lung. You also have to clear the
Clearness.
stomach heat. Remember?
Yes.
So when you talk about upper wasting, it's lung and stomach heat accumulation and fluid damage. Of course, when you have too much heat accumulating, you will also damage the fluids. You will init siya, 'di ba? Mawawala yung fluids. Okay. What about intense and exuberant stomach heat pattern? This is also known as,
Middle wasting.
yes, and how do you treat it?
Clear the stomach, enrich the kidney.
Nourish the kidney. Yeah, very good. And then what about kidney yin deficiency pattern? This is also known as,
Lower wasting.
yeah, okay. This reminds me of the patient ka. But anyway, mamaya na lang yan. Baka humaba. Baka manood pa si. Okay. Okay. Number 10. Okay. These are the main symptoms. So you will have to tell us what is the pattern. Vexatious thirst. Sabi mo nga kanina, parating thirsty. Of course, kung palating thirsty, you always drink, no? Polydipsia.
Yeah.
Uh, dry mouth and tongue, frequent excessive urination. So the tongue picture, and tip, red edges and tip. Okay. Thin yellow coating. So remember, it's yellow, so there's so much heat. The pulse is surging and rapid. So what is the pattern here?
Mm.
The pattern is,
It's lung stomach heat accumulation.
yeah, the first one.
Lung stomach heat accumulation and fluid damage.
Bakit hindi na lang kasi sabihin upper wasting, no? Here. Ay, yeah, okay. It's getting clearer. Okay. So what are the points? So remember, when you have lung stomach heat accumulation and fluid damage, you need to clear moisten the lung and clear the stomach heat. So what are the points?
Lung 5, kidney 7, and stomach 44.
Can you categorize the points? Lung 5.
Lung
Who's
Is the Hantayin of the lungs and the Hussey point.
yes. So the Hossy point.
Hussey point.
Um,
And then the kidney 7 is the foot Shao Yin of the kidneys.
mhm.
And also the Jing River point, the metal.
Okay. Wow. Jing
And Jing
stomach
River. And the
for.
stomach 44 is the foot Yang Ming of the stomach and the Ying Spring point.
Okay. So usually when there's heat, we use stomach 44, right? So remember this, lung 5, kidney 7, stomach 44. So it's basically lung, the hussy, and then the
Hussey.
main spring of the kidney, and I know, sorry, Jing River pala of the kidney. I'm sorry. And then Ying Spring of the stomach.
Yes.
Okay. Hussy, Jing River,
So for Ying Spring.
Ying Spring. Next. The main symptoms are polyphagia and rapid hungering after eating, which is the predominant symptom. I always notice this with some of my friends. Lesser degree of thirst. Okay. Polyuria, emaciation, dry bound stools. Tongue is red, yellow coating. Pulse slippery, large, forceful. So these are the main symptoms for what?
For intense and exuberant stomach heat pattern.
Yes, very good. So siguro clear na to for everyone, ha? And of course, the next question would be the points. General general points. That means you have to add other points. Okay, so what are the points?
Stomach 36, stomach 44, and kidney 7.
How do you categorize stomach 36? Di ba? The lower Hussey point of the
45, yes. And then the stomach 44 is the Ying Spring. And then kidney 7 is the Jing River.
very good. C point pa rin, no? Pero ito lower Hussey, no? Okay, yeah. Main symptoms, polydipsia.
Hello, Doc.
Yeah, can you hear me?
Yes,
Polydipsia, frequent copious turbid
yes, yes.
urine, frequent urination at nawawala kayo? Okay. Can you hear me?
Yes. Yeah. Chop, yes.
Grabe yung
Now
baha.
I can hear.
Okay. It affects even the transmission. Di ba? Frequent urination at night, fatigue, SOB, dry stools, constipation, pale face, malar
Yeah.
flush, emaciation, palpitations, dizziness, poor memory, haba. 5 pound heat, insomnia, profuse dreams, spontaneous sweating, night sweats. The tongue is fat and swollen, red with scanty coating and fluids, scanty fluids, so that a little dehydrated. Fine ang pulse and weak. So pag sinabi natin fine and weak, so that's very deficiency. Do you agree?
Yes.
Okay, so what is your pattern here?
It's the Qi and Yin dual deficiency pattern.
Yes, very good. Qi and Yin dual deficiency pattern. The SOB here is the Qi deficiency, including the spontaneous sweating. Kasi hindi lang siya spontaneous sweating, may night sweats pa. That's
Mm-mm.
what makes this very interesting, no? So
Yes.
you have two patterns here. Qi deficiency and yin deficiency. What are the general points?
General point, stomach 36, kidney 7, and spleen 6.
Yeah. When you use spleen 6, what is spleen 6 for?
Spleen 6 is for, it's a luo point, foot tie-in.
Yeah, pero it's supposed to be uh, treating the yin deficiency of 3 organs, no?
It's a three leg yin.
Really? Um,
Three.
kidney, the liver, and the spleen. Yeah. Okay. Fluid pattern, frequent abundant urination, possible turbid urine. Ay, may fat or grease. Even more frequent urination at night, dry mouth, dark blackish facial complexion, scorched dry auricles. Kaya tingnan yung mga tenga. Pag naging scorched yan, that's
Oh my
and dry. Ay, oo nga pala. I noticed.
God.
You know what? If you have pala cases, no, you get, especially pag na-admit, na-observe. Okay, dizziness, tinnitus, low back and limpness, itching, impotence, premature ejaculation. The tongue is red with scanty yellow coating or scanty fluids. Bowstring.
Motion. Fine.
Mm,
It's a kidney yin deficiency pattern.
yeah, kasi ano, this is a patient who would always pee in the, keep on peeing during the night, no?
Mm.
And then, okay, imagine na natin yung mukha. May tinnitus, low back knee. Okay. General points.
Uh, Kidney 27, bladder 23, and lung 9.
Ay, bongga. Bakit naging kidney 27? Yung akin kidney 3. Yin deficiency, di ba? Yuan source. Tapos ang 7,
Is it?
I don't know. Why do you use kidney 27?
To alleviate chi, harmonize the stomach.
Yeah, but the problem is yin deficiency. So,
Well,
of the kidney, no? So, we will
and
have to be looking at the allies of the kidney, like the lung. And of course, yin deficiency of the kidney doesn't develop overnight. So we are looking at the more chronic situation here. That's why we use the Bakshu point. No? And then kidney 3 is the Yuan source point. And the kidney 7 is kidney 7. Ano siya, di ba? Jing River, right?
yes, Jing River.
Next,
Jing.
we're almost done. Okay, main symptoms are loose stools, excessive thirst, normal to decreased appetite, low spirit, abdominal distension, which is worse after eating, emaciation, weakness, fatigue. The tongue is pale with dry white coating, fine, forceless tongue. So very, very deficiency. So what is this?
It's spleen, stomach, chi deficiency pattern.
Okay, spleen and stomach chi deficiency path. Points?
Stomach 36, spleen 3, spleen 6, and ren 6.
Okay, how would you categorize REN 6?
Ren 6 is for tonifies the kidneys, regulates the chi,
Why did we not use
and
REN?
harmonize. It's for
Okay, whatever. Basta ang spleen 3 is Yuan source. And of course, stomach 36 is the star.
spleen 3 is the shoestring.
Okay,
Shoe.
shoestring. So the Yuan. Spleen 6 is yeah,
Luo point. Three, the three-leg yin.
okay. Next, main symptoms: thirst with a liking for profuse drinking, excessive eating with rapid hungering or only a feeling of hunger, ductal and abdominal glomus and oppression, possible nausea, yellow slimy coating, slippery yan, ah, slimy. So there's
Mm.
definitely dampness here and heat, no? Kasi yellow. Yellow yung coating niya, no? Then the pulse is soggy or slippery, possibly rapid. The pattern is
Damp heat obstructing the center
very good.
pattern.
Okay. Points.
Ren 12, stomach 44, and spleen 9.
Okay. When you have heat talaga, especially sa stomach, no? Never forget the stomach 44, no? Kasi it's so important.
40.
When you have dampness, never forget spleen 9. Wala pa itong phlegm, so we don't use stomach 40 yet. Ren 12 is the
Front,
front mo of what?
front stomach.
Yes. Very good. Wow. Next, I think this is, yeah, the last one. Okay. Polydipsia, polyphagia, polyuria are not very marked. There's aversion to cold, feeling of cold in the abdomen, weakness, SOB, back and knee symptoms, tinnitus, deafness, seminal emission, impotence, spontaneous sweating, frequent clear copious urination, incontinence, loose stools, cockscrow diarrhea. The tongue is pale, swollen with moist white coating. The pulse is deep, thin, forceless, especially in the bar and cubit position. Cubit is soon, no? Okay. Sorry. Ano pala? Sure position.
Bar. It's
And
spleen.
yeah.
Yeah, it's a spleen and kidney yang deficiency
Yeah, this is
pattern.
very common, especially when you have cockscrow diarrhea, no? Spleen, kidney, yang deficiency. So the points are
Mm, Ren 4, do 4, kidney 7, and spleen 6.
wow, why?
Ren 4 is the front move of the front move of the SI. And then do 4 is for tonifies the kidneys. And then kidney 7 is the Jing River, and then spleen 6 is the Luo Point or the three-leg yin.
To do for is for the Mingmen fire, no? Okay.
Mm,
Fine. Okay. So I guess that's about it. This is also pretty common, no? Do you agree? Hmm.
yes.
So we'll continue next time. Thank you so much, Mom Trix. You were so good. And thank you for joining.
Thanks, Doc.